It's late autumn, and you're seeing a 3-week-old infant for a routine checkup. The parents mentioned the mother was vaccinated a few days before delivery, but aren't sure exactly when. You're also seeing several older adult patients in the same clinic. One is 78 and unvaccinated, and another is 65 with chronic heart disease. You need to decide who should receive protection against respiratory syncytial virus, RSV, this season. So let's work through this step by step. For children, you have RSV prophylaxis. For infants younger than 8 months, they should receive 1 dose of nirsevimab, a monoclonal antibody that gives passive protection against RSV if the maternal RSV vaccine was not given during pregnancy or cannot be verified, or the maternal vaccine was administered less than 14 days before birth, since there wouldn't have been enough time for antibody transfer through the placenta. So protection for infants can come from either maternal vaccination before birth or nirsevimab after birth. Not both usually, unless special circumstances apply. Now, for infants under 24 months and the second RSV season, some infants, especially those born premature or with certain medical conditions like chronic lung disease, congenital heart disease, or severe immunodeficiency, may need another dose of nirsevimab before their second RSV season. This is decided using CDC guidelines under indications for additional RSV prophylaxis. And the reasoning for this is that they remain at higher risk even after their first season of protection, and may not retain enough antibody levels from prior prophylaxis. In rare cases, nirsevimab may be given even to infants whose mothers were vaccinated if the clinician feels the infant is at exceptionally high risk for severe disease, like extremely premature infants, complex congenital conditions, or a poor maternal antibody response. So now let's look at our adult patients. For adults aged over 75 years, all unvaccinated adults in this group should receive 1 dose of the RSV vaccine, as they have the highest risk for severe low respiratory tract infection, hospitalization, and death from RSV due to age-related immune decline. And for adults aged 60 to 74 years, those with risk factors for severe RSV infection, like chronic heart, lung, or liver disease, immunocompromise, or frailty, should also receive 1 dose. This age group isn't universally vaccinated, but those with comorbidities benefit significantly from immunization. And pregnant individuals should receive the RSV vaccine during pregnancy, typically between 32 and 36 weeks gestation during the season. This provides passive antibody protection to the newborn through the placenta, reducing the need for nirsevimab after birth. RSV immunization can be given any time of year, but the ideal window is late summer or early fall, just before the season begins. Now let's go through our key decisions that we make here as a summary. So the first group, infants less than 8 months, 1 dose of nirsevimab if mother unvaccinated, unsure, or vaccinated less than 14 days before birth. Infants less than 24 months who are high risk, consider additional prophylaxis before the second season. Adults greater than 75 years who are unvaccinated, 1 dose of the vaccine, and 60 to 74 with risk factors, 1 RSV dose as well. And pregnant individuals from 32 to 36 weeks, 1 RSV dose, and the timing best in late summer or early fall. So RSV protection strategy depends on age, risk, and timing.